Hi, my name is Galina Primeau. I'm one of the PGY7s in plastic surgery.
And hi, my name's Catherine Wagner. I'm one of the PGY6s in cardiothoracic surgery.
Katie and I have known each other for a long time. We went to medical school together and we actually sang together. But now we're bonding over being surgeon moms. So I have 2 kids and 1 on the way. I've got a 4-year-old named Annika and an almost 2-year-old named Julian.
And I have 2 kids, a 3.5-year-old named Lucy, and then an 18-month-old named Oliver. You can never prepare yourself for the change that occurs when you become a parent. But I think what I was so amazed by and something I absolutely love about Michigan is the community of surgeon moms that you have here. Number one, you're not the first person to become pregnant during clinical time. There has definitely been a person that has had a pregnancy or started a family or gone through fertility treatments. We've kind of seen it all here. And so because you're not the first one, that path has kind of already been trod for you. There's a really strong culture of support for family planning in whatever journey that looks like, and obviously that's different for everybody.
Here we have a union, and so we have some very concrete protections that apply to all members of the union, which I think are fantastic and very reasonable. So one of those protections is that in the 3rd trimester, we're not expected to work more than 12 hours in a row, and we're also protected from doing overnight call in the 3rd trimester, and for a couple months postpartum, but most people are on maternity leave during that time. I think that having something on the books is very, very important, just because it keeps everybody accountable for, a minimum guideline that said that I think that all teams do their best to make sure that their pregnant residents are taken care of. At the end of the day, it's in nobody's best interest to have somebody who's, not well taken care of.
The policy kind of laid the groundwork for that protection and that support, but I truly believe it's a cultural thing here that we prioritize that, we value that. When I was even breastfeeding, faculty would set timers on their phone to say, okay, the timer's up, you should go scrub out and pump if you need to go do that.
I think that community is so important because that's where you get all of your strength from. And it was actually something that was very important to me when I was looking for a program. I was looking for places where I could see women in surgery specifically having babies earlier than their chief year, when they've got really a lot of things pulling at them.
Oh my gosh, I remember when I was I don't know why I'm getting emotional right now thinking about this, but I was pregnant as a 2, and I was really overwhelmed, and there was probably some component of pregnancy hormones as well, but it's your body is changing, you're in this crazy stressful but great job, and I actually reached out to Galina, and I was like, my nursery's not done, I have no idea how to be a mom, blah, 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 blah. And she literally came over that night with a bag of burp cloths, diapers, a swaddle, and said and some formula, and said, these are the only essentials that you need. That plus your plus the love that you're gonna have for your baby. And so that truly has stuck with me forever. But it just, I would do that for anybody, but it just is emblematic of the support that's here.
You got me too.
Yeah, I know.
It's a universally hard thing to do, to be a parent, to be a mom, to be a working mom, to be a surgeon mom, and it's so easy to bond over it. I think that as soon as you find somebody else in residency who is a surgeon mom, it's just you have an instant connection like that, and everybody's just so happy to help. I imagine it's got to be like that everywhere. It's just just our sense of community, but I definitely feel it here. And yes, at this point, I am the the go-to person.
For me, it really refocused my perspective from thinking about myself to thinking about others. And that has really helped me connect with patients better. It kind of recenters, what I want to do in life is help other people. And I think having children really helped me gain that other perspective. I'm also way more focused at work because when I'm at work, I want to be 100% at work. When I'm at home, I want to be 100% at home. And so I really want to make my time at work count and get as much as I can out of it. So there's a WhatsApp group that a lot of the surgeon moms are on, and it ranges from asking for help finding nannies or babysitters to texting each other pictures of rashes and hey, my kid has this cough, do I need to get them looked at? So that's kind of nice because you have a consult to whoever, just a text away.
Another group is it's called, I think, Dr. Milk is what it's called. So it's breastfeeding support for doctors who are trying to continue that journey for themselves, and it's also very, very active, and there's a lot of really good support on there. I also breastfed both of my children. And then for the childcare, Michigan through and this is for all medicine employees, not just for residents, but they have a program for emergency childcare that you might need because it's otherwise interfering with you being able to do the job. And they have a subsidized rate for the first 48 hours. So for example, for my 2 kids, I think right now it's like $13 an hour, which is way, way cheaper than it would be otherwise. And these are like vetted, like
first aid trained.
First aid trained, background checked adults who are, ready to help out, not like my literal 15-year-old neighbor across the street who actually watches my kids. And then I know that some of our residents have gone in on a nanny share together. So they've, hired nanny together to watch both kids. I know that that's been very successful for some of them. And I know that there's a few nannies around who specifically have worked with multiple residents and kind of understand some of the unpredictability of the resident schedule and some of the demands of it. And so those people are a really great resource as well, because if you're looking for somebody who already kind of understands the surgery lifestyle, then that's an easy way to go at it. I think figuring out your support, and not just emotional and not just with your colleagues, but figuring out the practical part of who's going to take care of your baby, because I think that can be very stressful. And when you have late nights and you've got nights that are unpredictable, where you think you're going to be home at one time and it turns out you're not going to be home until much later, it's such a weight off your shoulders to know that your child is cared for and loved and safe. I'm very lucky my husband stays home, and he quit his job after we had our first baby. And I know that no matter how late I have to stay at work, my kids are always taken care of. I know that other people make it work in other ways, and whatever makes sense for their family. It's not all just hard work, and it's not all sleepless nights and whatever else. I mean, it's some of those things too, but it's also just really fun to have. Like, I'm not having more kids because it's a big chore. I'm having it because it's a big joy in my life, right? So I'm excited to have that part of my life. I'm happy that I got that part of my life started before the end of residency, because it's also been this like big shining bright spot in my day. When I come home and my kids are giving me these giant hugs, and they get it. They can actually recite to you exactly what it means when my pager goes off and what it means to be on call and how it's my turn to take care of patients. And, we work it out. But it's really fun.
And I think that there's a way to bring your kids into your clinical life too. We still do in-house call for our cardiac surgery rotations, and when I'm on call on the weekends, my kids will come and have dinner with me at the hospital. And
my kids do that too.
Yeah. So it's super fun, and they get to see where I work, and my daughter colors me pictures and all that stuff. And I think it's really rewarding to try to be a role model for them, and
My 4-year-old wants to be a surgeon when she grows up, so we can have matching scrubs. We have to have purple scrubs.
That's adorable.
Yeah.
My 3.5-year-old is between a doctor, an astronaut, and a pilot.
The best thing is that she actually doesn't think that men can be doctors, because
my daughter is the same.
Everybody I know who's a doctor not everyone I know, but like everybody we hang out with happens to be a woman. So she doesn't think that men can be doctors.
We were at one of my faculty members' house the other day, and my husband was like, "Oh, this person who's hosting us is a doctor," and she said, "He can't be a doctor because he's a boy."
I'm not going to correct my daughter for a long time. She can keep that illusion for as long as I can keep it going.
Yep.
Yeah.